Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Tendinitis. Introduction. Tendinitis is a common condition that causes swelling around muscles and bones. It happens most often in the shoulders, elbows, knees, hips, heels, or wrists. Tendinitis is usually caused by overuse or by repeated injury to a certain area. People who perform activities that require repetitive motions or place stress on joints are at higher risk for tendinitis. This program will help you understand tendinitis. It explains its symptoms, causes, and treatment options. Bones, muscles, and tendons. Tendons are found throughout your body. Tendinitis happens when one of your tendons becomes inflamed. The following section reviews information about your bones and muscles to help you better understand how tendinitis affects your body. Bones help you stand up straight, and muscles help your bones move together. Bones connect at the joints. The most obvious joints are the shoulders, elbows, wrists, hips, knees, and ankles. Other joints are found between the different bones of your fingers and toes. You also have joints that allow your vertebrae to move. Tendons are the tough cords of tissue that attach muscles to bones. Tendons help create movement by making the muscles push or pull the bones in different ways. Some tendons have special names. For example, the tendon that connects the calf muscles to the heel on the back of the foot is called the Achilles tendon. Tendons can be small, like those found in the hand or ankle. They can also be large, like the Achilles tendon. Tendons are found throughout your body. Tendinitis is what happens when a tendon becomes inflamed and swollen. Symptoms. Tendinitis means inflammation of one of your tendons. This inflammation happens in the soft tissue around muscles and bones. It happens most often in the shoulders, elbows, knees, hips, heels, or wrists. Pain and soreness around your joint may be a sign that you have tendinitis. The pain may be described as an ache and can be felt more when you move the affected limb or joint. Pain may also radiate to other areas. The area around a joint with tendinitis can sometimes look red and swollen. See your healthcare provider if you experience joint pain so severe that you have trouble moving, pain that lasts more than 1 week, pain that interferes with daily activities. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Causes. The main cause of tendinitis is overusing a joint. You may overuse a joint by doing repetitive tasks. Repeated injury to a certain area, such as the wrist or ankle, can also cause tendinitis. Tendons become less flexible with age and are more likely to become damaged. Inflammation of a tendon may also be caused by arthritis, diabetes, infection, thyroid disease. Tendinitis may be related to old age. People perform a lot of physical activities throughout their lives. These activities require them to repeatedly use their tendons. Over time, this can cause the joints to become inflamed. Risk factors. Your risk of developing tendinitis increases with age. As you get older, your joints become more stressed. This increases the likelihood that you will develop joint-related pain. For this reason, age is a risk factor for tendinitis. People who regularly perform tasks that require repetitive motions have an increased risk of developing tendinitis. This includes carpenters, gardeners, musicians, and athletes. Some common forms of tendinitis are named after the sports that increase their risk. They include tennis elbow, golfer's elbow, pitcher's shoulder, swimmer's shoulder, jumper's knee, Certain medical conditions may also increase your risk of developing tendinitis. Arthritis, diabetes, and gout have been linked to cases of tendinitis. Diagnosis. A diagnosis of tendinitis begins with a medical history and physical examination. A good diagnosis depends on your healthcare provider knowing the location of the pain, when it began, what you were doing when it began, how long the pain lasts, what relieves the pain, what makes the pain worse. As part of the physical examination, your healthcare provider may perform a selective tissue tension test to determine which tendon is affected. Touching specific areas of the tendon allows your healthcare provider to pinpoint the area of inflammation. Your doctor may also use an MRI to confirm inflammation. The imaging test detects both bone and soft tissues like muscles and tendons. An anesthetic injection test is another way to confirm a diagnosis of tendinitis. A small amount of anesthetic is injected into the affected area. If the pain is temporarily relieved, the diagnosis is confirmed. To rule out infection, your doctor may remove and test fluid from the inflamed area. Treatment. Your healthcare provider can treat the common causes of tendinitis. Complicated cases may require referral to a specialist, such as an orthopedist, a rheumatologist, and/or a physiatrist. Treatment focuses on healing the injured tendon. The first step in treating tendinitis is to reduce pain and inflammation. Reducing pain and inflammation is done with rest, pressure on the affected area, and elevation. Over-the-counter anti-inflammatory medicines such as aspirin or ibuprofen can also help. Ice may also be used in injuries. However, most cases of tendinitis are considered ongoing and ice is not helpful. If tendinitis is the result of an acute injury and ice is needed, an ice pack can be applied to the affected area for 15 to 20 minutes every 4 to 6 hours for 3 to 5 days. Your healthcare provider may recommend longer use of ice. Your doctor may advise you to limit the amount of activity involving the affected joint. This can encourage healing and prevent further injury. Physical therapy may help. Strengthening and stretching exercises are often used. In some cases, protective devices may temporarily reduce stress to an inflamed tendon. This speeds up healing. Protective devices include foot orthosis for the ankle and foot, or splints for the knee or hand. These devices allow general activities like walking to continue as normal. For severe cases of tendinitis, you may receive an injection into the area around the swollen tendon. A corticosteroid injection can help reduce inflammation and pain. Your healthcare provider may inject part of your own blood into the affected tendon to help it heal. This is called a platelet-rich plasma injection. Iontophoresis may also be used to deliver medication to the affected area. Iontophoresis uses an electrical current to push the medicine through the skin directly over the inflamed tendon. Severe cases of tendinitis may also be treated with therapeutic ultrasound. Therapeutic ultrasound is a type of physical therapy in which sound waves are used to massage certain tissues. It warms deep tissues and can improve blood flow. If there is still no improvement or if a tendon is completely torn, surgery may be needed to repair the damage. After surgery, an exercise program is needed to strengthen surrounding muscles to prevent repeat injury. Prevention. There are several ways to prevent inflammation or reduce the pain caused by inflammation. When engaging in physically demanding activities, warm up or stretch before an activity. Begin new activities or exercise regimens slowly. Increase physical demands after completing several well-tolerated sessions. Talk to a physical trainer about exercises to strengthen the muscles around your affected joints. When going about daily activities, practice good posture and position your body properly. Take breaks from repetitive tasks often. Do not sit still for long periods. To reduce the pain caused by tendinitis, cushion the affected joint using knee and elbow pads that have foam. Increase the gripping surface of tools using gloves or padding. Use 2 hands to hold heavy tools or equipment. If you have a history of tendinitis, talk to your healthcare provider before engaging in new exercises and activities.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. People get tendinitis by overusing a joint. It is also caused by repeated injury. Your risk of developing tendinitis increases with age. Regularly performing the same motions also increases the risk of developing tendinitis. Pain and soreness around your joint may be a sign that you have tendinitis. The pain may be described as an ache and can be felt more when you move the affected limb or joint. Pain may also radiate to other areas. Treatment focuses on healing the injured tendon. The first step in treating tendinitis is to reduce pain and inflammation. Reducing pain and inflammation is done with rest, pressure on the affected area, and elevation. Over-the-counter anti-inflammatory medicines such as aspirin or ibuprofen can also help. For severe cases of tendinitis, you may receive an injection into the area around the swollen tendon. A corticosteroid injection can help reduce inflammation and pain. Physical therapy may help. If there is still no improvement or if a tendon is completely torn, surgery may be needed to repair the damage. After surgery, an exercise program is needed to strengthen surrounding muscles to prevent repeat injury. There are several ways to prevent inflammation or reduce the pain caused by inflammation. When engaging in physically demanding activities, warm up or stretch before an activity. Begin new activities or exercise regimens slowly. Increase physical demands after completing several well-tolerated sessions. Talk to a physical trainer about exercises to strengthen the muscles around your affected joints. If you have a history of tendinitis, talk to your healthcare provider before engaging in new exercises and physically demanding activities. Thank you for using Explain.